Imagine you or someone you care about starts experiencing a persistent cough, unexpected weight loss, or night sweats. It can be concerning to think about what might be causing these symptoms, especially when something serious like tuberculosis comes to mind. When active tuberculosis is suspected, the very first step is for healthcare providers to act quickly to confirm the diagnosis and prevent any potential spread. This means immediate isolation for the suspected individual, usually at home if there is not a high risk of transmission, or in a hospital setting if necessary. The focus is on rapid testing and careful medical evaluation. The urgency comes from the nature of active tuberculosis. It is an infectious disease, primarily affecting the lungs, that can spread through the air when an infected person coughs, sneezes, or talks. Confirming or ruling out active disease is critical not only for the individual's health, but also for the health of their family and community. Rapid diagnosis ensures treatment can begin right away, making the person non-infectious and starting their path to recovery. A healthcare professional will begin by conducting a thorough medical history and physical examination. They will ask about your symptoms, your exposure to anyone with tuberculosis, and any past medical conditions. Next, several key diagnostic tests are performed. These typically include a chest X-ray to look for changes in the lungs that are characteristic of tuberculosis. You will also likely provide sputum samples, which is mucus coughed up from your lungs. These sputum samples are crucial for what are called acid-fast bacilli smears and mycobacterial cultures. The acid-fast bacilli smear can quickly show if there are bacteria present, giving doctors an early indication. However, a mycobacterial culture is the definitive test. This involves growing the bacteria from your sputum in a laboratory, which can take several weeks, but it confirms the diagnosis and allows for drug susceptibility testing to determine which medications will be most effective. Beyond these initial steps, a healthcare team will also typically perform a tuberculosis skin test, or a blood test known as an IGRA. Spelled IGRA, these tests help determine if you have been exposed to the tuberculosis bacteria at some point, whether it is an active infection or a latent, non-infectious infection. They provide important context for your overall health picture. In some cases, if the diagnosis is still unclear, or if tuberculosis is suspected in other parts of the body beyond the lungs, additional tests may be ordered. These could include a CT scan of the chest, or even a biopsy where a small tissue sample is taken for examination. An important part of the process is also contact tracing, identifying anyone who might have been exposed to the suspected case, so they can be tested and, if needed, receive preventative treatment. Ultimately, after active tuberculosis is suspected, a swift and coordinated response by healthcare providers is essential. Through careful evaluation, specific diagnostic tests, and timely treatment, individuals can recover fully, and the risk of spreading this disease to others can be effectively managed. Early diagnosis and adherence to treatment are your best tools for a healthy future.